It's 5:16 in Michigan this morning. Some doctors say there is an under-recognized rise in the cases of Lyme disease in the U.S. If caught early, the disease is treatable, but many patients don't get the characteristic rash at the site of a bite. Shayna Ziegler reports how patients and doctors are speaking up about a disease that some are calling the next pandemic.
10 years ago, Julie Hutchinson came down with a mysterious set of symptoms.
Depression, severe fatigue, insomnia, series of vertigo. I had unexplained tendonitis that would not heal, flutters in my eyes. This one's the anti-parasitic.
The busy mom went from doctor to doctor who suggested it could be over 10 different conditions.
A couple of doctors mentioned HIV, possibly AIDS.
After 7 years, she finally got a definitive diagnosis: Lyme disease. The CDC reports about 20,000 cases of Lyme disease have occurred in the U.S. in recent years, but says actual numbers could be up to 10 times that amount.
This is a Lyme disease patient I just saw yesterday.
The root of the underreporting? Some doctors say it lies in the blood test.
CDC recognizes 3 strains right now, but there might be 3 other strains.
Doctors also disagree on treatment. Dr. Saikon uses IV antibiotic therapy for 4 months or longer on some of his patients. The Infectious Diseases Society of America says the long-term treatment carries risks like antibiotic resistance and infection, and recommends a shorter course of less than 2 months based on 3 NIH studies.
All 3 studies indicated that prolonging antibiotic treatment after as much as 60 days did not seem to have any further effect.
Bullshit. The Infectious Disease Society needs to stop their guidelines. Make them just recommendations.
Yes. One thing most agree on?
Change needs to happen. That too?
Julie underwent long-term antibiotic therapy. She hopes to save others from the unanswered questions that troubled her for years. Reporting for Healthy Living, I'm Shayna Ziegler.
Besides a rash at the site of a tick bite, symptoms include joint pain that migrates from one joint to another, fever, chills, fatigue, and body aches. Well, a trip to the theater is a trip down the